Hello, my name is Caitlin. I'm going to be the nurse practitioner doing a full assessment on Lily here today. First, we're going to start with general observation. I'm just going to note her current state. We're going to be looking at spontaneous movement of her arms and legs, and noting her posture and her tone. And then we are going to observe her respiratory rate, counting that for 15 seconds, and also noting any use of accessory muscles or any type of distress. And then we're going to next move on to the hair, skin, and nails. We're going to look at the general color. We're going to take a closer look at all the crevices of her body, noting any markings, lesions, or abnormalities that we might see. We're also going to be noting the texture of her skin, the moisture level, and the fat distribution. We'll do a little skin trigger test to test for hydration. And then we're going to look at the nails, the size, shape, and color of all of her nails. And while we're here, we're also going to be checking cap refill. Next, we're going to look at her hair. We're going to look at the general distribution, texture, and pattern of her hair, and noting any hair swirls, or if there's any abnormal body hair, such as a tuft of hair on the sacral area. Next, we're going to move on and look at the head. So we're looking at the head shape and its size. We did an FOC measurement, and we'll compare that to her previous measurements on a growth chart. We are also going to palpate these suture lines just to make sure that they are approximated, and noting if there's any flat spots on her head from maybe positional plagiocephaly. And then we are going to palpate the posterior fontanelle if we can, and the anterior fontanelle. Next, we're going to move on to the face. We're just looking at the general symmetry of the face, and any unusual facial features that we might see. And then we're going to try to kind of make her mad and see if we can check the movements of her face when she's crying for symmetry. Then we're going to move on and look at her neck. We're going to kind of just assess it for symmetry. Then we're going to palpate for any masses in the neck, checking for any webbing. And then moving down to the clavicles, palpating those for any masses, and the upper chest for crevitus. And then we are also going to just note the trachea and make sure it's midline. And then we are also going to attempt to palpate the cervical lymph nodes, but that's pretty hard to do in a baby, but we'll check anyway. And then next we're going to move on to the face. We're going to check the eyes for size and symmetry and their shape. We're going to look at the intracanthus distance between the eyes, and then we are going to see if she can fixate and track objects. So I'll put my hand really close and see if she can track my finger left to right and then up and down. Next, I am going to look at her red reflex of her eye. And then I'm going to look at the size, shape, and reaction to light of both of her pupils. And then finally, I'm going to see if we can elicit the blink reflex. I'm going to flash light in her face and see if she either blinks or closes her eyes. Okay. And then just noting any drainage, redness, or trauma to the sclera. And then we're going to move on to the ears. We're just going to check the outer structures, noting any tags or pits. We're going to fold the ears to see if the recoil, and then we're going to check their position by following the outer canthus of the eye down the side of the head to see if the ear insertion at the top is in line with that. And then we are going to go ahead and take a look inside of the ear canal. And we are checking the ear canal as well as the tympanic membrane of both ears. And then we're going to see if we can elicit an auditory response to stimuli. Then next we're going to move to the nose. We're just looking for general symmetry of the nose. We're going to check the septum for any deviations. We're going to take a quick look in each nair. And while we're this close, we'll just kind of listen for any noisy breathing that she might have that would indicate potential obstruction of the nairs. And then we are going to move down to the mouth. We're looking at the general shape and size of the mouth and lips, noting that the philtrums are present, and then assessing the jaw size and position. Then we're going to look at the mucous membranes of the mouth, and then we are going to note if there's any cleft lip. We will run our thumb through the roof of the mouth, feeling the soft and hard palate of the mouth for any clefts there. We'll take our tongue depressor and we're going to examine the tongue for its size and tone. We're going to look for any tongue ties or lip ties. Then I'm going to depress the tongue and look in the back of the throat for any masses. We're also going to note the position of the uvula, and then I'm going to give her a quick gag to check her gag reflex and note if there's any deviations of the uvula. I'm also going to look in her mouth for any natal teeth, and then finally, to calm her down, I'm going to let her suck on my finger for a second to check the strength of her suck reflex. And then we are going to move on to the chest. We are going to be noting the general shape of the chest, noting the sternum, if there's any deviations there. And then we're going to check the nipples, their placement, their size, shape, and color, and if there's any secretions or fissures, and if there's any accessory nipples. Then we're going to palpate the chest for any masses in the axillary area. And then we're going to go ahead and listen. So we're going to listen to her breath sounds. We're going to do it in a crossover and down pattern. Across, then down, across, down, across, in all 6 positions, and then we'll do the same thing posteriorly. Across, down, across, down, across. And while we're here, we're going to listen to her heart rate. We're going to auscultate that and count it for 15 seconds. We're also going to be noting the rhythm of her heart rate. Then we're going to listen to the aortic, the pulmonic, the tricuspid, and the mitral areas of her heart for any murmur. Then we're going to observe for any precordium. And then we're going to find the apical impulse. It should be on the left side, about the midclavicular or slightly to the left of that, in the 4th intercostal space. We checked her blood pressure already. So next we're going to feel her femoral pulse, and we are just going to check, count this for 15 seconds and then compare it to the auscultated heart rate. Then we are going to palpate the left and right femoral pulses, checking for the force and making sure they're equal. We'll do the same with the brachial pulses, comparing those, and then we are going to compare an upper and a lower. We'll do the right side brachial and the femoral, and just compare those to make sure they're equal. Then next we're going to move on to the abdomen. We're just looking at the color of the abdomen, noticing any loops or distension. Before we touch, we are going to auscultate all 4 quadrants, listening for any active bowel sounds, up to 5 minutes. Then we're going to listen over the liver for any bruits. We're going to note the umbilical area for any hernias. We are going to palpate the abdomen for any tenderness, guarding, or masses. And then we're going to check the inguinal area. We are looking for any inguinal hernias that she might have. And while we're here, we are going to check the genital urinary. So we're going to look at the vaginal structures. We're going to note the clitoris, the urethral meatus, vaginal canal, the peritoneum, and then the rectum. And then while she's got her diaper off, we'll flip her over and just check her sacral area. Then next, we are going to check her musculoskeletal. So we'll start at the top and work our way down. We are going to check her neck first. We're checking passively the rotation and the flexion of her neck. Then next we're going to check her arms. First we'll start with the length, then we will check the range of motion and strength of her shoulders, elbows, wrists. Then we're going to make sure that she has 5 fingers on each hand, and checking that she spontaneously opens them. We're going to assess the creases of her hands and then see if we can elicit a palmar grass reflex. And then we'll move on to the hips. We're checking for any dislocations in her hip joints and making sure that they're stable. Next, while she's in this position, we are going to put her feet up with her knees raised and check the femur length with the Alice test. And then we are going to pull her legs straight to check the length. Then we're going to check the range of motion of the hips, knees, and ankles. Last, we're going to check the feet, that each foot has 5 toes on it. I will run my finger down the sole of her foot to check the Babinski reflex to see if there's flexion of her toes. Finally, we'll flip her over and we're going to check the curvature of her spine all the way down. You can also put pressure on one side or the other of the spine, and the hip should kind of rotate up in the same direction to check that reflex. And then finally, we are going to check our Moro reflex. So I'm going to see if we can elicit that startle. Okay. And that was a full assessment on Lily. Thank you.